What I'd like to focus on for the next sort of 10 minutes or so is airways. My favourite organ is the lungs, and I'd like to talk a little bit about lungs. And we know how much COVID-19 affects the lungs. And if we look at mice and people, there are obviously similarities. We're both mammals, but if we look specifically at airways, there are huge differences that are incredibly significant when it comes to a disease like COVID-19. Now, you might already know that mice don't get asthma. Mice don't get chronic obstructive pulmonary disease, which is a smoking-related lung disease that people get. Even if you put a mouse in a box and fill it full of cigarette smoke for days and days and days on end, the mouse will not get the same lung disease that a person who smokes does. Mice don't get cystic fibrosis. This is a genetic disease that people have, and unfortunately, lung infections for people with cystic fibrosis often prove fatal. You can fill a mouse's lungs with bacteria if you've modified it to have cystic fibrosis, and it's not really bothered. It's not the same. And some of that is due to the differences in the airways between mice and human. So it's not just about size. Mouse lungs are incredibly different to human lungs. They have a different cellular composition in their airways. They have different proportions of different cells at different levels of their airways. They have a different architecture to their airways. So there are these huge, really significant differences that mean it's very difficult to look at what happens to a mouse and map it onto a person. And we see that, we call that a translational failure. And as Kat said in her introduction, mice are not naturally susceptible to COVID-19. So in order to get a mouse to even start to look like a human with COVID-19, you have to modify that mouse. You have to put a gene in it that is going to make it express something that COVID-19 would like to stick to be able to infect it. And by the time you've done that, really, how realistic is that going to be? And if we're looking at an infectious disease, then we've got to think about the immune response. We like immune responses, they're good for us, they help us out. They're very different for mice and people. A mouse lives in a different environment to people. They're small and they kind of scurry about on the floor. It's pretty dirty down there, certainly on my kitchen floor. So the mice have developed different defenses to people. We're a bit bigger, we're higher up, aren't we? We're not kind of in such filth as mice and other rodents are. So that immune response is different. So we've got the response to the infection is going to be specific to the species, basically, and specific to the pathogen. And so we're not going to get that ability to work out what's going on in a person by looking at a mouse.